noon. November is National Diabetes Awareness Month, but the Mississippi Diabetes Foundation is raising awareness all year round. And joining us live right now from Ridgeland is Irena McLean, the Executive Director of the Mississippi Diabetes Foundation. How are you, Irena?
Great. How about you today?
I am doing well. So tell us a little bit about the Mississippi Diabetes Foundation.
Right. We were chartered back in 1965 primarily as an organization to give information to medical professionals. And we've morphed and become, equally as important to health professionals dealing with patients with diabetes as we are with the lay public, parents of children with type 1 or type 2 diabetes, adults with diabetes. We are also a big resource for patient assistance and information around the state.
Okay, and when it comes to eradicating diabetes, particularly when you look at the state of Mississippi being one of the states with the highest numbers, what is it that you all are trying to do?
We're trying to raise awareness of the genetic, predisposition of diabetes, that if you have family members with sugar, you are at risk for developing sugar, which is kind of a colloquial term for type 2 diabetes. We are also aware that if there's type 1 diabetes in the family, people can get tested for that for the antibodies, since type 1, the rarer form of diabetes, is an autoimmune disease. And it is something that we can find out someone's potential for developing that even years before they actually start seeing changes in their blood sugar. So we have that, trying to make people aware of family histories, also trying to make people aware that the more you exercise, the healthier you eat, the less likely you are to develop type 2, the more common type of diabetes. It's getting that info out there. I was at a health fair this morning at the Jackson Medical Mall. Someone said, well, I'm eating right, I'm eating oatmeal, and I put raisins and trail mix on it. And I said, but you've got to remember those carbs in the trail mix, especially with a concentrated sugar of dried fruit. So we discussed, something like doing a diced apple instead of that, and maybe a handful of walnuts instead of doing trail mix. Just little changes, little things, getting more sleep, reducing your stress. All of that can reduce your chance of developing diabetes.
All right, now, Irena, before we let you go, because we are running out of time, the Walk for
Sure.
Diabetes in Columbus, you all have decided to cancel that. Am I correct?
Yes, we've postponed it. We're looking at I guess it's the second Sunday in April. It's the Sunday after Easter, which would be, I believe, the 12th of April. It was a really tough decision because you don't want to have something scheduled, have publicity, and then have to cancel it. But with the potential for, rain and rough weather, we don't want to put anyone's safety at risk. And traditionally, our walk is from the upper level of Riverwalk going down a fairly steep ramp. We just didn't want to, put anyone at risk for slipping and having any problems with that. But we'll be back in full force, and it gives us more time to come on up and visit beautiful Columbus, and make some other connections out there to get more people out to the walk.
All right, then. Well, thank you so much, Irena McLean, for joining us this afternoon.
Thank you for having me.
We'll be right back.